Hello, welcome to the teacher channel. Welcome to this presentation, Choking Emergency. So on this slide, you can see everything you need to know about choking, at least at this level. Choking cheat sheet is a summary of all you need to know about choking. Generally, choking occurs when the airway is blocked, either partially or completely by a foreign object. Example of a foreign object is a piece of food. As you can see on the cheat sheet, choking is of two types. Mild choking is also called partial choking. The second type is severe or complete choking. Now, partial airway blockage is mild choking, and it is when the piece of food partially blocks the airway. Remember that the airway is a tube, is a passageway between the lungs and the external walls through the nostrils. Breathing occurs within the airway. So we breathe through the airway, we breathe in oxygen, and we expel carbon dioxide through the airway. So if that airway is partially blocked by a piece of food, that will result to mild choking. In mild choking, loud cough is evident, is present. Other signs and symptoms include the teary eyes and flushed face. What should we do when that happens? Your first aid, your basic care is to encourage the person to cough so that the object will be blown out, will be expelled by the cough force. So the victim could be a baby who is under 1 year, a child who is between 1 year and puberty, and an adult who has gone through puberty or going through puberty. Now, on the other branch, the complete airway blockage is called severe choking. In this case, the airway is completely blocked at some point by a foreign object. And when that happens, oxygen will not be able to go inside the body, and the body will not be able to expel oxygen from the body. So this is a very serious critical condition to be in. When this happens, the person will not be able to make meaningful sound. At the best, the person may make high-pitched sound. There could be teary eyes. The person will grab the throat with one hand or both hands. So, there are two conditions possible depending on the time, the duration, how long this has been the case. The person may still be conscious. In this case, the oxygen in the blood is enough to carry this person for some time. So in that conscious state, that is when the first aider should intervene. If the person, the victim, is an infant, a baby, relax that infant on your elbow. Support the neck. Make sure the head is slightly lower than the body, and use your thigh as leverage. Then provide 5 back blows between the shoulder blades then turn the baby up, and then give 5 chest thrusts. This should be repeated as long as the foreign object is still there. However, if the object is not expelled, this baby will go unconscious. So while the baby is still conscious, repeat 5 back blows followed by 5 chest thrusts. Continue this until the foreign object is expelled. Otherwise, with time, the infant will be heading toward unconsciousness. If this is a child or adult who is still conscious but severely choking, then provide 5 back blows between the shoulder blades followed by 5 abdominal or chest thrusts until the foreign object is expelled or the patient becomes unconscious. So you give 5 back blows followed by 5 abdominal abdominal thrust or 5 chest thrusts depending on the size of your patient. So if the patient is obese or maybe pregnant and your hand cannot go around the waist, you can do chest thrust in that case. So hopefully the foreign object will be expelled, otherwise this patient will go unconscious. And when that happens, you need to change your strategy. You need to switch to another type of first aid called CPR. So lower your patient on a flat firm surface in a supine position, meaning the back is, the patient is lying on the back. Okay, call 911 immediately. You need to request an AED, and then you start high quality CPR, which comprises of series of 30 chest compressions followed by 2 breaths. Remember that before you give 2 breaths, you check the mouth. If you see the object, you carefully scoop it out before you give the breath. But if you don't see anything, don't do that. Just attempt to give in 2 breaths. Choking prevention. Children should be supervised while they eat. Very important. Number 2, don't rush when you eat. Please eat slowly to prevent choking. Chew your food properly. Chew your food properly. Number 4, no physical activities. Example, playing while eating. This is very important. Number 5, no driving while eating. No driving while eating. Number 6, don't consume large amount of alcohol before or during meals. Reason, alcohol impairs muscle reflexes, so choking may not be recognized on time. Number 7, no talking or laughing while eating. Thank you so much for watching. Please follow us on Facebook at The Teacher Channel. You can also follow us on X, formerly Twitter, at First Aid CPR 2. Thank you so much. I appreciate your time. Please like this video before you leave. Comment, put your comment at the comment box below. Share it to family members, to colleagues, and to friends. And if you have not subscribed, please subscribe and then turn your notification bell so that when next I upload a video, you will receive it. So thank you so much. Thank you so much for